families find out that their child has been diagnosed with inflammatory bowel disease, there suddenly becomes a halt in what they thought their world would be like, not only for the child, but themselves.
When a child or any patient receives a diagnosis like IBD, that can be a very disempowering experience. No one chooses to have a chronic illness, especially one that comes with a lot of stigma and shame potentially because it involves the digestive system.
We help these patients facilitate getting the care that they may need so that they have better coping strategies during this difficult time period.
NewYork-Presbyterian has a pediatric patient navigator, and what that navigator does, among many other things, is to allow children to go back to school safely. She actually works with the schools. She makes sure that there are plans in place called 504s, where patients have accommodations, so should they need extra tutoring, if they need books in both the classroom and at home, she can help navigate that.
Patients often do not realize that they are entitled to what is called a 504 plan through their schools. That even extends to college plans as well. That includes that they get to have unlimited access to the bathroom if and when necessary, for their right to not be discriminated against for their condition for anything that they may need or they may deem discriminatory, and have excused absences when necessary because of their condition.
She can write letters that will allow patients accommodations, whether it's for testing or whether it's even bathroom privileges. And so having her work directly with the school system is absolutely powerful to getting that child back to their life.
There can be a lot of difficulty negotiating just, social situations that are hard for any teenager. But if you have a disease that affects your digestive system and maybe you can't eat what other kids can eat, that can be really, really challenging. And anything that makes you feel not like other kids can be very upsetting and make you feel isolated.
These patients tend to have issues with anxiety perhaps, or depression. They may encounter experiences with substance abuse that they may not know how to handle. By educating these patients about substance abuse and how to deal with these encounters, or about medication compliance, or recognizing that they may have some psychosocial stressors in their life that go beyond just being an adolescent, or how they may play a role in exacerbating their disease, we will be able to better recognize those issues and then help that patient.
By explaining to them what the disease is, what the options are, and the most important thing of having frequent and close monitoring, that if you can do that successfully, then there's no reason that you can't travel, you can't go to the college of your dreams, you can't become a football player.
They should continue to pursue all of the goals that they had. It's possible that they'll hit bumps along the way, but they'll never be alone. We're a team.
We know that there are 2 United States presidents who both had IBD, and so if someone can be the leader of the free world, then there's no reason why the total child can't achieve whatever they would have ever wished for.